We have quite a large head and neck cancer program at the University of Alberta. We're one of the highest volume centers in North America for that type of work. So we have a lot of patients coming through who need big major head and neck cancer surgeries. Most of those patients will require radiation therapy after that surgery. And there's a complication of radiation that's well known but not very commonly talked about, and that's long-term low thyroid levels. So thyroid gland is very sensitive to radiation therapy, and at quite low doses of radiation therapy, it will stop functioning. We sort of thought the fundamental principle behind this should work. So the thyroid is controlled by hormones that really float through the bloodstream, and they kind of tell the thyroid gland what to do. So our assumption is that as long as there's blood going in and out of that thyroid gland, wherever it is in the body, that it should still maintain that normal thyroid function. As part of that surgery, we isolate, in this case, the left side of the thyroid gland, and we leave it attached to the blood vessels at the top. So that's the artery and vein that go into the thyroid. So once we're ready to move it, we take it down into the arm. This is the tissue that we've used in the arm to reconstruct, and then we've attached it to those cut blood vessels that we've left behind in the arm, and then it gets its own blood supply down there.
They told me that they could move it into my arm, otherwise my thyroid would it wouldn't work after radiation. The radiation would just take its life away, right? It wouldn't function. And I'd have to be on pills for the rest of my life. It's just magnificent what they can do. My thyroid is working. I'm not on any medication.
We've actually had fairly good interest in this. We've had a lot of both interest from the public and professionally. So we've had the journal publications which have helped, and we actually were just recently contacted by a large center in New York, and they've actually already identified patients that they think would be candidates for this, and they're asking our advice and expertise in terms of the technical aspects of how to perform it.